August 22nd, 2012 meeting of the Ways and Means Committee will now come to order. Will the clerk please call the roll?
Ms. Andrews, Mr. Antelli, Mr. Daniele, Mr. Gamina, Mr. Haney, Mr. Hanna, Ms. Kaylee, Mr. McCann, Mr. O'Brien, Mr. Tucciarello, Chairman Yolovich.
Here. Are there any speakers signed up for the public forum?
There are not.
Is there anyone here that would like to speak that didn't sign up? Seeing none, the next item on the agenda is the approval of minutes. You have the minutes of the July 25th, 2012 meeting in your folder. They will stand approved unless the clerk is notified of any changes by the end of the day. Madam Clerk, new business.
Referral 12-238.
Moved by Legislator Gamina, seconded by Legislator McCann. I see that Mr. Michiki or Legislator Michiki is here. Legislator Lightfoot is not. Legislator Michiki, would you like to speak to this?
Thank you, Chairman Yolovich. I just want to summarize my remarks from last night at Human Services by briefly outlining exactly what this referral is going to do for prepared food vendors in Monroe County. Prepared food vendors will now be able to apply for a permit with the Health Department for an annual fee of $170 instead of the $700 to $1,400 range they have paid in the past. The new structure will be sure to enhance local farmers markets for members of our community. The vendors will not need to renew their permit every 2 weeks as they have in the past. Also, it is important to note that the Health Department will continue to inspect these vendors at the rate that they currently do to ensure the health of the community is not compromised. The submitted proposal will make the new fee category effective January 1st, 2013. I want to thank my Republican colleagues and my colleagues on the other side of the aisle for working together in a spirit of bipartisanship to get this proposal put together. Thank you, sir.
Legislator Michiki. Is there any further discussion? All those in favor, please signify by saying aye. Opposed, motion carries. Next item, please.
Referral 12-242.
Moved by Legislator McCann, seconded by Legislator Daniele. Is there any discussion? Hearing none, all those in favor, please signify by saying aye. Opposed, motion carries. Next item, please.
Referral 12-243.
Moved by Legislator Daniele, seconded by Legislator Tucciarello. Is there any discussion? Hearing none, all those in favor, please signify by saying aye. Opposed, motion carries. Next item, please.
Referral 12-244.
Moved by Legislator Tucciarello, seconded by Legislator Antelli. Is there any discussion? Hearing none, all those in favor, please signify by saying aye. Opposed, motion carries. Next item, please.
Referral 12-245.
Moved by Legislator Antelli, seconded by Legislator Hanna. Is there any discussion? Legislator Kaylee.
Thank you, Mr. Chairman. Just briefly, I know that this is
Got the right one?
Yeah, no, I do. Thank you. I wanted to ask through you to the administration how the 10-cent per gallon surcharge was calculated.
10 cents added every gallon that they buy.
I understand that, Mr. Chairman. The rate. Let me rephrase that. How did we get that rate per gallon?
Lieutenant Dave Phelps, Monroe County Sheriff's Office. I can answer this through the chair. We've had existing fuel contracts with a variety of localities throughout the county. They are placed at appropriate distances so that we don't have to drive great distance to obtain fuel. It also saves us the money of not having to build our own fuel stations throughout the county, which would be quite expensive. What we're able to do is establish a contract with various agencies, which they provide the fuel stations and maintain the fuel stations. And we pay a slightly higher cost than the government contract rate, which goes to help support the use of the station and the upkeep of keeping the fuel station working.
Thank you. Through you to the administration, in the setting of the 10 cents per gallon itself, has there ever been a study or a calculation of that exact rate as to why it was set at 10 cents versus 5 or 15?
have to have Jen answer that. To be sure. My understanding is we've maintained that rate for a period of time. Sheriff's Corporate Counsel, Jen Summers, would probably be better that she does the negotiating to handle that question, and she is not here tonight.
Thank you.
We can get back to you with specific information if you like.
I'd appreciate that, thank you.
Any further discussion? All those in favor, please signify by saying aye. Opposed, motion carries. Next item, please.
Referral 12-246.
Moved by legislator Hannah, seconded by legislator Gomina. Is there any discussion? Hearing none, all those in favor, please signify by saying aye. Opposed, motion carries. Next item, please.
Referral 12-247.
Moved by legislator Gomina, seconded by legislator McCann. Is there any discussion? Hearing none, all those in favor, please signify by saying aye. Opposed, motion carries. Next item, please.
Referral 12-248.
Moved by legislator McCann, seconded by legislator Daniele. Is there any discussion? Legislator Andrews.
Thank you, Mr. Chair. Through you, this is the first year we've received this grant. I wondered if someone could explain a little bit more what sort of intervention will be provided to the high-risk gang-involved offenders.
Assistant Chief Probation Officer. The services that are provided to these youth include intensive case management services. We have an in-house GED preparation program, employment services, and some cognitive behavioral programs, one of which is called AMPS, which is like an anger management program.
Thank you. And through the chair, the referral also targets 60 high-risk gang offenders. Out of what possible total number would that be? Would you?
Are you through the chair? Are you asking how many? That 60 out of how many probationers we have?
How many probationers that would fall into this category? Yes.
I wouldn't have a specific number for you. I could try to get that information and get back to you.
Thank you. That'd be helpful.
Is there any further discussion? All those in favor, please signify by saying aye. Opposed, motion carries. Next item, please.
Referral 12-249.
Moved by legislator Daniele, seconded by legislator Tucciarello. Is there any discussion? Legislator Haney.
Thank you, Mr. Chairman. This experimental program has been underway now for several years. Do we yet have any data about the success of the program and its impact, actual impact on recidivism?
Through the chair. The objectives for this program are different than in previous years. So recidivism data for those is not available, but a recent report from Catholic Family Center showed that out of 178 cases referred to re-entry from parole, only 29 were violated for either technical violations or a new offense, approximately 16.1%.
So the recidivism, so this 179 or 178, what is that again? What?
That is the number of cases that we referred to re-entry from parole.
Okay.
And out of those, it was a 16.1% recidivism rate.
So 15% you said recidivism?
Approximately 16%.
18%?
16, Paul.
16%. The normal recidivism rate is like 60%, isn't it? 60?
Approximately 40 to 60%.
I'm sorry?
Between 40 and 60%.
Okay, so even at the low end, it is showing significant improvement then.
Yes.
So there's only been, this program, and I realize the first couple of years were just establishing it, et cetera, but in the several years that this program has been in operation, there's only been 178 people referred to it?
Through the chair, no, sir. What I'm saying is that it's the most recent report involved 178 cases.
Oh, okay. Do we have any statistics in total? I mean, for the years that it's been in I mean, Through you, Mr. Chairman, the reason I'm pursuing this is because I've asked this question before and always been told we didn't yet have any data, so we now apparently have data. Do we have any cumulative data showing for the life of the project what the success rate is?
Through the chair, I don't have that information available tonight. As I stated, the objectives for the program were somewhat different earlier, so if we were to compare that data, it would likely not be as meaningful.
So the program, through you, Mr. Chairman, the program is changing?
Through the chair, we'll provide some additional data before the full legislative meeting.
Okay. I'd appreciate that because this program, frankly, has a great deal of promise associated with it. And for the small group that you mentioned, it indicates they're having great success, and I think we ought to be publicizing that. I mean, we shouldn't be burying it under a bushel basket. We ought to be proud of it. Thank you.
Any further discussion? All those in favor, please signify by saying aye. Opposed, motion carries. Next item, please.
Referral 12-250,
Moved by
authorized.
legislator Tucciarello, seconded by legislator Antali. Is there any discussion? Hearing none, all those in favor, please signify by saying aye. Opposed, motion carries. Next item, please.
Referral 12-251,
Moved by
authorized.
legislator Antali, seconded by legislator Hannah. Is there any discussion? Hearing none, all those in favor, please signify by saying aye. Opposed, motion carries. Next item, please.
Referral 12-252,
Moved by
acceptance.
legislator Hannah, seconded by legislator Gamina. Is there any discussion? Hearing none, all those in favor, please signify by saying aye. Opposed, motion carries. Next item, please.
Referral 12-253,
Moved by legislator Gamina, seconded by legislator McCann. Is there any discussion? Legislator Haney.
Through you, Mr. Chairman, the $1,981,000 that's cited in the transmittal, is that merely to pay for the administrative costs of the program, or does that include the cost of the nutrition supplements as well?
Through you, Mr. Chair, the $1.9 million only pays for the administrative part of the program. The food that the participants purchased is paid for by New York State. Obviously, is significantly more than the part of the program that we administer.
So the beneficiaries have like debit cards or something that they use?
That's correct.
Okay. Through you, Mr. Chairman, do you have any idea what the value of the food supplements might be?
Through you, Mr. Chair, I don't have that. We can try to find that out.
Yeah, just a rough number might be interesting. Thank you.
Any further discussion? All those in favor, please signify by saying aye. Opposed, motion carries. Next item, please.
Referral 12-254,
Moved by legislator McCann, seconded by legislator Daniele. Is there any discussion? Legislator Haney.
Through you, Mr. Chairman, my question is, how does this actually work? I mean, how do the medical records get accessed? I mean, there's a great deal of law about the privacy of medical records, et cetera.
Through you, Mr. Chair, there are medical records in a variety of different settings throughout the community. We have a public health nurse that goes to those institutions and accesses the medical records. The rules of confidentiality are a little bit different for public health. We have access to medical records for patients that have the reportable communicable diseases so that we can exercise our government function trying to control those communicable diseases.
So, through you, Mr. Chairman, when you, I assume HIV/AIDS is a reportable condition, and when you are informed that subject A has contracted the disease, this nurse then goes out to their medical providers. Is that what happens?
Through you, Mr. Chair, that's exactly correct.
Thank you.
Any further discussion? Hearing none, all those in favor, please signify by saying aye. Opposed, motion carries. Next item.
Referral 12-255.
Moved by legislator Daniele, seconded by legislator Tucciarello. Is there any discussion? Hearing none, all those in favor, please signify by saying aye. Opposed, motion carries. Next item, please.
Referral 12-256.
Moved by legislator Tucciarello, seconded by legislator Antelli. Is there any discussion? Hearing none, all those in favor, please signify by saying aye. Opposed, motion carries. Next item, please.
Referral 12-257.
Moved by legislator Antelli, seconded by legislator Hannah. Is there any discussion? Hearing none, all those in favor, please signify by saying aye. Opposed, motion carries. Next item, please.
Referral 12-258.
Moved by legislator Hannah, seconded by legislator Gamina. Is there any discussion? Hearing none, all those in favor, please signify by saying aye. Opposed, motion carries. Next item, please.
Referral 12-259.
Moved by legislator Gamina, seconded by legislator McCann. Is there any discussion? Hearing none, all those in favor, please signify by saying aye. Opposed, motion carries. Next item, please.
Referral 12-260.
Moved by legislator McCann, seconded by legislator Daniele. Is there any discussion? Hearing none, all those in favor, please signify by saying aye. Opposed, motion carries. Next item, please.
Referral 12-261.
Moved by legislator Daniele, seconded by legislator Tucciarello. Is there any discussion? Hearing none, all those in favor, please signify by saying aye. Opposed, motion carries. Next item, please.
Referral 12-263.
Moved by legislator Tucciarello, seconded by legislator Antelli. Is there any discussion? Hearing none, all those in favor, please signify by saying aye. Opposed, motion carries. Next item, please.
Referral 12-266.
Moved by legislator Antelli, seconded by legislator Hannah. Is there any discussion? Hearing none, all those in favor, please signify by saying aye. Opposed, motion carries. Next item, please.
Referral 12-267.
Moved by legislator Andrews, seconded by legislator Haney. I apologize. When this referral came through, I looked at it and I tried to recall the last meeting and what the discussion sounded like. And just to make sure I was right in my mind, we went back and listened to the tapes of the meeting. So I have it in my mind very securely that it was promised to us by the administration that particular night that we would get a full report once this study was completed. So when I saw the referral, I thought, gee, that's kind of a little redundant, but that being the case, it was accepted, it was assigned to this committee, so we have to deal with it. And I think the easiest way to deal with it is to just refer it to the administration for their consideration. And so basically that's what I'm going to do with it. Actually, no, Carrie, there isn't any reason to speak to it. It's been referred to the administration. It's been discussed in
because this was submitted to this committee, and I'd just like to be able to address it before you refer it.
well, I've already referred it.
Well,
So
you
is
indicated
there-
you were going to refer it, so I'd like an opportunity to speak to it before you actually make the action, take the action of referring it to the administration.
Well, I already
I-
took the action. I've
well,
already referred it.
Mr.
I don't
Chairman,
see
I'm
any
sure you could
reason-
allow me the courtesy of speaking to the referral for a brief 3 minutes, or less even, I promise less.
All
If you
right.
would allow me a couple of
Okay.
minutes. Thank you, Mr.
right.
Chair.
That's my better judgment.
I'm sorry?
It's against my better judgment, but I'll do it because I've already referred it. Go ahead.
Well, I appreciate the opportunity. I did submit the referral, as you mentioned, last month. We authorized a contract for the county to undertake a dependent eligibility audit for county employees and retirees, and regarding the health insurance and dental insurance programs. As a result of going through that audit, the county and the company that we contracted with will be searching for ineligible dependents that are still enrolled in our health and dental insurance or dental insurance programs. During the discussion that evening, it was stated that the contract will be cost neutral, but because the contract will be cost neutral, but there's the possibility of realizing significant savings from undertaking this audit, and if in fact large numbers of dependents are found to still be on the county's health or dental insurance programs. And so what I'm requesting through this audit, because I do not have the same recollection as you from that evening in terms of what was exactly promised. I do recall some conversation about me requesting this information that evening, but I do not recall receiving a promise from the administration that that information would be provided. So therefore, this referral just simply asks for the number of dependents that are deemed ineligible and removed as a result of the audit, and then the cost savings that are realized. Thank you for the opportunity to speak. I feel a referral speaks more strongly than just referring it to the administration, because it's an actual commitment that it'll be back by the date that is listed in the referral, whereas submitting a request to the administration wouldn't have as much strength
Okay.
as passing it this evening.
Thank you, Legislator Andrews. Is there any other unfinished business to come before this committee?
On the early one, when the referral talks about reporting back no later than December 31st, is it yours or our expectation that we would have a report back to the administration that's, once it's been referred, consistent with that kind of time frame?
The original discussion at last month's, I believe it was last month's legislature meeting, the July meeting, was that they expected to have the study done before the period where people could get in or get out or change carriers. And as far as I'm concerned, we should have an answer shortly after that.
And I think that's right.
Yeah. That's what they promised us. They said when the study was done that they would report back to us. So that's why I felt this was a little redundant, but it's done now and it's been referred. So again, is there any other unfinished business to come before this committee? Hearing none. The August 22nd, 2012 meeting of the Ways and Means Committee stands adjourned. The next meeting of the Ways and Means Committee is scheduled for September 26, 2012 at 6 p.m.